What I would wish for all patients, and what in hindsight, I wished had happened to me, was that all patients who are at risk of developing cancer treatment-related lymphedema would be aware of the risk. There is more research that needs to be done, but what we do know is that breast cancer patients have about a 1 in 5 chance of developing lymphedema in their lifetime. Up to 50% of gynecological cancer patients survivors, up to 75% of head and neck cancer patient survivors, and up to 30% of melanoma patient survivors. What we do know is that early intervention, early monitoring, and early assessment is key to getting better patient outcomes. So what that means is, and what I wished had happened to me, was as soon as I'd been diagnosed and before I even had surgery, I should have received a baseline assessment for lymphedema. It's really easy, it's quick, it's non-invasive, and at LIF they've got a really fabulous protocol in place for that. So it's a simple measurement on what's called a SOZO machine, and it will give you an assessment. So if you start developing symptoms, swelling or pain, you can speak to your clinician and they can have a look and see, we might pop you on the SOZO again. And if you have increased your levels on the SOZO by a certain amount, that might indicate an early stage lymphedema, and there may be some intervention that is right for you. Intervention for lymphedema could be some very specific exercises. It might be some light compression garments, and they would be prescribed to you by your clinician. You may need some physio, you may need some what's called MLD, some very specific massage that's for helping the lymphatic flow, and you may need to revisit what's going on with those garments. There could be some different types of garments you might need to wear. There are some preventative measures that you can take to help reduce your risk of lymphedema. The first thing is know if you are someone who is at risk. That's a really important thing to be aware of. I really suggest that you ask your clinician straight out, am I a patient who will be or could be at risk of developing cancer treatment-related lymphedema? Another thing to think about in terms of if you are at risk of lymphedema is managing weight. So weight gain and diet is really important. Now we know that diet's important in cancer anyway because it can help with a whole host of things. So it's not an add-on, it's just a reminder that diet's important because it also helps with lymphedema, keeping the risk down. It's actually better to do some exercise, but again, if you are noticing symptoms or if you start doing some exercise and it might exacerbate the swelling, again, come back and speak to your specialist about it. There may be some very specific exercises that are right for you. And I think on top of it, my top tip is always listen to your body. If there are changes that are happening, go back and speak to your specialist about it. The message from my heart to patients who may be at risk of developing lymphedema is to be empowered to ask about and find out about your risk factors and what you should do. The message from my heart to our clinicians is to please provide our patients with that information so that they can be empowered to also take care of their early stage symptoms and take care of their lymphedema should it happen.